Welcome to the deep dive.
Great to be here.
Today we're tackling a really interesting subject, how the whole idea of quality in healthcare and operations has, well, evolved over time.
Yeah, it's a fascinating story, actually.
We've got a great set of sources lined up, stuff from the National Accreditation Board for Hospitals and Healthcare Providers. You'll hear us call them NABH.
Right.
Insights from Supremediq Consultancy, the international view from iSquad, that's the International Society for Quality in Healthcare, and even a script from the QI playbook, plus a summary text pulling it all together.
So the goal is really to pull out the key milestones, the big trends.
Exactly. So you get a clear picture of how healthcare quality got from, point A to where we are now.
Think of it as getting the core narrative without digging through every single report. We want that big picture, the shifts in thinking.
And understanding that journey, that context is just so crucial, isn't it?
It really is. It explains why we do things the way we do now.
And helps appreciate that this push for better patient care, smoother operations, it's definitely an ongoing thing.
Absolutely. And some of the early ideas, seemingly simple stuff, they really laid the groundwork for today's complex systems. It's quite surprising sometimes.
Okay, so where do we kick this off? Where does the story really begin?
Well, looking at our sources, you really have to go back to the mid-1800s. Florence Nightingale, Crimean War.
Ah, Nightingale. More than just the lady with the lamp, then.
Oh, and much more. Her compassion is famous, sure, but her systematic approach was revolutionary for the time.
Right. She wasn't just tending to soldiers. She was collecting data meticulously.
Exactly. Who was living, who was dying, and crucially, why? What were the conditions?
And then she used visuals, right? Pie charts.
Pie charts. In the 1850s, to show her findings to officials. It was groundbreaking data analysis and, well, data visualization.
So what did the data actually show? That's the key part.
Well, here's the insight. It wasn't mostly the battle wounds killing soldiers in the hospitals. It was infections, diseases spreading within the hospitals.
Ah, so that led her to focus on.
Basic stuff, but critical.
Yeah.
Hygiene, better ventilation, sanitation. Things we might think are obvious now.
But weren't standard practice then, especially in those conditions?
Not at all. And her data directly challenged the sort of prevailing miasma theory, the idea bad air caused disease. It was a huge shift.
And the results, implementing those changes.
Dramatic improvements in survival rates. It's such a powerful early example of data-driven improvement, focusing on the environment, basic hygiene. Massive impact.
It really underscores the power of just, well, washing hands and keeping things clean when you apply it systematically. Amazing historical fact.
So if we jump forward a bit to the early 20th century, we see a really interesting influence starting to filter in from a completely different world.
Which is?
Industry, manufacturing, ideas about efficiency, process improvement.
Right, this is where you see connections across fields. You're talking about people like Frederick Winslow Taylor.
Exactly. Taylor and his scientific management, all about optimizing work, standardizing tasks for maximum efficiency.
And Walter Schuhart from Bell Labs.
Yes, Schuhart brought in statistical process control, understanding variation in processes using statistics.
Now, those names might not immediately shout healthcare to people.
Probably not, no.
Yeah.
But their core ideas, absolutely foundational.
So Taylor's scientific management, how would that apply? Like breaking down tasks?
Precisely. Think about standardizing surgical prep. Every step defined, sequence clear, minimizing errors, like an assembly line, but for procedures.
Okay, I see that. And Schuhart's statistical control, managing variation.
Imagine tracking infection rates. His methods help you see if a rise is just normal fluctuation or a real statistically significant spike you need to investigate. It's about managing processes based on data.
And you can really draw a straight line from those early industrial concepts
to things like Lean and Six Sigma, which came much later but became huge in healthcare.
It's all that same DNA, isn't it? Streamlining, reducing wasted time, materials, effort cutting down on errors or defects.
That core principle of continuous improvement, yeah. Linking manufacturing floors to hospital wards in a way.
Okay, so moving into the 1960s, things start getting more formal, more specifically healthcare focused.
Yes, definitely. This is when we see a real concerted effort to define and ensure quality within healthcare itself. Key organizations pop up.
Like the Joint Commission, that sounds familiar.
That's a big one. They started accrediting hospitals based on actual standards.
So setting a baseline, a consistent level of care.
That was the goal, yeah. A major step towards consistency.
And around the same time,
Yeah.
There's a key figure, right? Avedis Donabedian.
Donabedian.
Yeah.
Absolutely pivotal. He introduced his structure, process, outcome model.
Okay, break that down. Structure, process, outcome. What do they mean?
It's a really elegant framework, still incredibly relevant. Structure is what you need. The facilities, the staff, their numbers, their qualifications, the equipment, the money.
Your resources, basically.
And process is what you do.
Yeah.
How care is actually delivered, the procedures, the interactions, the decisions made.
The actual delivery of care.
And outcome is what happens.
Yeah.
The result for the patient. Their health status, their satisfaction, mortality rates, recovery time. Did the care work?
Structure, process, outcome. Got it.
And the power is seeing how they connect. Good structure enables good process. Good process leads to good outcomes.
It gives you clear areas to look at if something isn't working.
Exactly.
Huh.
Where's the issue? Structure, process. You can analyze it systematically. A really clear, memorable way to dissect quality.
Okay, so fast forward again. Late 80s, 1990s. What's happening now?
This is often called the third wave, and it's characterized by an even more direct import of those manufacturing ideas we touched on earlier. But now it's widespread.
This is where Deming comes in strongly.
Oh, yes. W. Edwards Deming and his 14 points for management. Huge influence. Emphasizing systems thinking, understanding the whole process, not just blaming individuals. Continuous improvement as a philosophy.
And total quality management, TQM. That was big then too, wasn't it?
It's very big. TQM is about involving everyone, top to bottom, in constantly improving quality to meet patient needs and expectations.
A whole organizational culture shift.
Ideally, yes. And then, of course, you have Lean.
From Toyota.
Right, Toyota's production system, focused on eliminating waste, maximizing value, and Six Sigma.
Motorola's baby.
Very data-driven.
Extremely data-driven, aimed at reducing defects and variation to near zero. Rigorous stuff.
So how did hospitals actually use these? Give us some examples.
Oh, they got very practical. You saw projects tackling patient wait times in ERs.
Big one.
Huge. Streamlining the steps for surgeries pre-op, the OR, post-op. Making lab test turnarounds faster and more accurate.
Reducing errors seems key, too.
Absolutely critical, especially medication errors. Using these methods to build safer, more reliable systems, learning directly from how manufacturing managed complexity and safety.
Those real-world examples really show the benefit, don't they? Taking industrial ideas into the human side of healthcare.
Definitely. It wasn't just theory anymore. Okay, so that brings us towards the modern era, the 2000s onwards. What defines this period according to the sources?
They often describe it as the evidence-based, data-driven, and patient-centered era. And technology plays a massive role here.
Electronic health records, EHRs.
Absolutely, a total game changer. Suddenly you can collect and analyze vast amounts of patient data, insights into treatments, outcomes, processes. It's immense.
And things like real-time dashboards.
Yeah, letting clinicians see key quality metrics right now. Infection rates, wait times, whatever. Allows for immediate feedback, quick intervention.
Clinical audits get easier too, I imagine. Incident reporting.
Much more sophisticated and systematic with digital tools. Easier to spot patterns, learn from mistakes, prevent recurrence. It's about better information, faster.
Now, during this time, national accreditation systems also evolved, right? You mentioned NABH earlier.
Yes, NABH in India is a key example highlighted in our sources. What's interesting is how it adapted global quality frameworks.
To the specific Indian context.
Exactly. Tailoring international best practices to the diverse needs and realities of healthcare in India.
And NABH is part of the Quality Council of India, set up to manage accreditation.
Right. Its goal was, and is, to set up these accreditation programs, aiming to meet consumer needs, set benchmarks for the industry's progress.
And operate with autonomy, supported by stakeholders.
Precisely. A structured approach to driving quality improvement nationally.
And now, looking at the cutting edge, where are we heading?
We're seeing AI, machine learning, predictive analytics starting to make a real impact.
So not just improving current quality, but predicting problems.
That's the really exciting part. Using data to identify potential risks, forecast system breakdowns before they happen, moving towards proactive prevention.
Wow. So if you summarize that whole sweep...
Quite a progression, isn't it? From Nightingale focusing on hand washing and sanitation,
to standardizing complex procedures.
then optimizing whole systems using industrial methods.
And now using AI to actually anticipate failures. It's incredible.
Yeah. To make this evolution feel more real, it helps to look at it from the ground level.
Okay.
Our sources mentioned the QI Playbook podcast, featuring a fictional quality manager in India. That gives some great practical perspective.
Right, a window into the day-to-day reality of putting these principles into practice. What does that highlight?
A really key shift. Initially, a lot of quality effort was just about compliance, ticking boxes for audits, like the NABH audits.
Just getting the certificate on the wall.
Kind of, yeah. But the podcast character stresses the move towards building a genuine culture of quality.
So not just for the audit, but everyday practice.
Exactly. Embedding quality improvement into the daily routines and mindset of everyone in the hospital.
Are there examples of that?
Yes, things like having hand hygiene champions on staff, people actively promoting and checking hand washing.
Peer influence.
Right. And daily morning safety huddles. Teams getting together quickly to flag risks, discuss any incidents from the last 24 hours, plan preventative steps.
Concrete stuff that builds that culture.
Definitely. And the podcast also hits on how technology makes quality more visible now.
Those dashboards you mentioned.
Dashboards showing real-time infection rates in different units so staff can react quickly if something trends up.
What else?
Barcode scanning for medications, huge impact on reducing errors. Patient feedback apps getting input directly from patients about their experience.
Using tech to enhance safety and the patient view.
Yeah, there was even a specific example of using heat maps, visual maps, to track where hospital-acquired infections were occurring within the building.
Wow, that's a powerful tool for targeting intervention.
Very powerful. And another great point from that podcast source was advice for new quality professionals.
Which was?
2 things, mainly. First, understand the history. Know where these QI ideas came from. It gives you context and appreciation.
Makes sense. And the second?
Listen to the frontline staff. They're the ones doing the work. They know the real problems and often have the best ideas for improvement. Don't just sit in an office.
Crucial advice. So, okay, let's try to synthesize all this. Looking back across this whole journey, what are the really key overarching trends?
Well, number 1, as the sources stress, is that big shift away from just basic standards and inspection.
Towards a more holistic, systems-based approach.
Exactly. Focusing on continuous improvement and really putting the patient at the center of everything.
We also talked about the adoption of formal quality management systems, QMS.
Right. Providing that structure for managing and improving quality systematically across the organization.
And technology's role seems undeniable. EHRs, patient registries.
Transformative. For data, for analysis, for coordinating care, and alongside that, a much bigger emphasis on building a strong safety culture.
Data and measurement also seem central now.
Absolutely critical. You see it in initiatives like those from CMS, the Centers for Medicare and Medicaid Services with all their quality measures and reporting. Data drives improvement.
And accountability.
A growing emphasis on that, yes. For individuals, for their practice, and for the organizations themselves, for their overall performance and outcomes. Everyone has a role.
So really, the defining feature of modern quality management is
that commitment to continuous improvement. It's never done. It's a constant cycle. Assess, change based on evidence, measure the impact, reassess.
And there are specific historical examples that illustrate parts of this journey, right?
Oh, definitely. Think back to Ignaz Semmelweis in the 19th century, pushing for hand washing to stop childbed fever. An early focus on a specific process change with huge impact.
Or the American College of Surgeons setting up hospital standardization in the early 20th century, setting those baseline standards.
Right. Then more recently, things like the patient-centered medical home model, focusing on coordination and the patient experience in primary care.
And we already covered the adaptation of Lean and Six Sigma from industry to tackle waste and errors in healthcare processes.
Exactly. All these examples paint that picture of evolution.
So wrapping it all up, the big takeaway is this move.
From being reactive, just fixing problems after they happen,
to being proactive, building strong systems.
Exactly. Proactive, systems-based approaches that prioritize patient well-being foster that culture of continuous improvement and demand accountability. That's the essence of the evolution.
So as we finish this deep dive on the evolution of healthcare quality, it's clear we've covered a lot of ground.
We really have.
From Florence Nightingale's foundational work on hygiene and data,
through adopting industrial efficiency ideas,
to today's focus on patient-centered care, data analytics, continuous improvement, accreditation bodies like NABH, and all the technology involved.
It's been quite the transformation, driven by a deeper understanding of healthcare's complexities and just a relentless drive for better patient outcomes.
Absolutely. A fascinating journey indeed. And that leaves us with a final thought for you, our listener. Consider how these core ideas of quality improvement systems thinking, continuous improvement, focusing on outcomes might apply outside of hospitals and clinics.
Yeah, how could they apply to maybe your own work or even just your approach to well-being or efficiency in daily life?
How can that systems view and that drive to constantly get better be applied more broadly? Something interesting to perhaps mull over.